Good afternoon. It's really a privilege to be here in Minnesota. Obviously, I came from Duluth, went to North Dakota, and I'm back in Minnesota. And I just really want to thank many of the people I have met in Minnesota over the last few days. Obviously, we spend a lot of time driving around. We drive into communities, we stay in hotels, we eat in local restaurants to really try to understand how the community is interacting with the mitigation measures. And I have to say, throughout many of the places we have stopped in Minnesota, between rural gas stations and urban areas, there is a real attention to these mitigation efforts in the urban areas. But there really does need to be improvement out in many of the rural areas. And I think what we have noticed over the last, really since July, we have seen a continuous kind of significant number of infections in the Twin City area and in the counties, the 9 surrounding counties. And we've seen that as between 400 and 500 cases every single day for the last about 8 weeks. And we really were meeting with the team and meeting with your local experts to try to understand why is that happening, what can be done, and how can it be prevented. We've been really impressed while we were eating out last night that your restaurants are really very much following the guidelines. We don't see that everywhere. And so that was very reassuring. But every Minnesotan needs to follow the guidelines. And what do I mean by that? There really needs to be this common sense adaptation to everybody's personal life of wearing a mask, preventing large crowds, really this 6 feet social distancing, or having a mask on whenever interacting with individuals, and then all we need to do relevant to our personal hygiene and washing hands. Why is this important? Because we know that there's a lot of young people who get infected and don't know they're infected, and they take that virus home to their vulnerable mothers or fathers or grandparents, and that is what started the hospitalizations, and certainly the mortality that we see is still remaining very much around those individuals who have pre-existing conditions that make them not more susceptible to infection, but more susceptible to a worse outcome. And so we really need to together, as Americans and as Minnesotans, really work together to protect the vulnerable. What have we seen across this country which may have a specific relevance here? We find that when people gather together in private as family members and neighbors, they make assumptions that there couldn't be anybody that has infection there. And then they don't wear their mask and they interact together. And that creates spreading of the virus among family members and among neighbors. And that is the piece I think we're doing much better job in public and our public mitigations. We have to take those home to private and ensure we're also doing that in the household, protecting our grandparents and our aunts and uncles that may have comorbidities. And so if you've gone to a party or you've been on college campuses and you've gone to a party, please don't interact with your grandparents or that aunt with a comorbidity unless you're wearing a mask. We really have to work to protect one another when we know we have done things that may have exposed ourselves to the virus. And we have to understand that a lot of people in the younger age group won't get symptoms. And so if you're a young person, please protect your moms, your dads, your grandparents, your aunts, your uncles, or children in the household that may have comorbidities. This is what we can do for each other every day. To every student on every college campus, if you go to one of those events, you really need to protect others. Wear your mask when you're around others after that, and please try to get tested. It's really important. We know we can't always be perfect. We know that we'll put this message out about private gatherings and something will happen and you'll realize you have been in a situation, you've been around people, you didn't have your mask on. That is the time to make sure you're protecting others in your household and around you by wearing a mask when you're around them, even if they're family, and really taking the time to protect one another. Really want to thank the governor and his health team and the legislature for really their engagement and for the discussion we had. In general, Minnesota is really getting testing into the nursing home and protecting those that are most vulnerable that are in nursing homes. But we have vulnerable individuals throughout the state. And I just want to conclude by I had a great meeting with the tribal nation, one band of the Chippewas, I think the Font du Lac group. They were really terrific. I think across this country, being able to meet with the tribal nations has really been extraordinary. Listening to their issues relevant to testing, relevant to isolation. I was impressed by their ability to have institutions that could support isolation within their community, and I think really ensuring that they have the resources and the wherewithal to prevent outbreaks when we know across the United States still the #1 group that has the highest fatalities related to this virus are our Native Americans. And so really ensuring that we have continued to focus resources and meeting their needs. Second is across now the United States is our Hispanic communities, and really ensuring that during any social gathering in Hispanic communities that we're really protecting one another and wearing masks, particularly if we may have exposed ourselves unintentionally to the virus. And that's followed then by our African American community and then followed by white Americans. And so this is really, we have to pay attention to this every day. I know that it's difficult. I know people are getting fatigued when it comes to COVID, but together we can make it through these next few months, really protecting one another. And that was really my message today. I want to thank the governor and his team for their time. I want to thank a lot of your leaders that have come from your public health world, from your long-term care facilities and your hospitals. The dialogue was really extraordinary. Your team had some real specific asks for me to take back to Washington, which I will, and I had some very specific asks of them, and so it was a really important partnership and dialogue. I'll take questions.
What was your conversation with the governor?
It was very much about what's happening in the Twin Cities, and really two things. What are we going to do together to increase mitigation or increase uptake of mitigation and increase uptake of mitigations in households as we protect one another? And secondly, we've watched over the last 4 weeks. We write a governor's report every week. The 10th one will go out this week to the governor, so we previewed that with the governor. This state has gone from 2 to 5 to now 9 counties, over 10%. That trend is worrisome this late into the summer, so we really talked about how that's going to be tackled. It really does come down to every Minnesotan following these common sense path forward to ensure that we protect each other, and really a lot of that pathway goes through wearing this mask, not just in public but also in private if we need to protect others in the household, and really ensuring that if we're outside, we're wearing a mask if we're within under 6 feet of each other. And I see that happening on the street, never intentionally, but everybody should have their mask with them whenever they're outside, because that can happen. So we discussed those two pieces.
Dr. Birx, you said that there were some asks from the governor and state health officials, and then you in the White House had some asks. What did the governor and state health officials ask the White House for, and what has the White House asked the governor to do?
That's a great question. So the governor and their health officials really wanted to ensure, and I will take this message back because it's not just Minnesota, that there would be flexibility in CARES Act funding past the end of the year to really be able to utilize that to critical needs. That is also the same ask that has come from the tribal nations. And our ask was to really help us understand what's happening in this Twin Cities area, to really understand how we can further mitigate to bring those cases down, and how do we prevent spread into further counties. I think many people who have been watching the South will understand that that was very different than what the United States experienced in March and April. March and April, as in with Minnesota, was very much a single metro or a large metro event, and the few bedroom communities around that metro. What happened after Memorial Day was very much more widespread through wide asymptomatic spread before people started presenting to emergency rooms with symptoms. And so in Mississippi, Alabama, Louisiana, you had 95% of counties with more than 10% positivity, rural and urban counties. And so as you start to see some of your other counties, both rural and urban, start to tick up, that's the time to really work with both the rural and urban communities to make sure that they know the same common sense guidelines. Sometimes people, just like we sometimes believe our family could never have COVID and spread it to us, sometimes in rural communities, because of their experience in March and April, see this virus as more of a New York City or a big city kind of phenomenon. No, this virus has gotten very much into rural areas, and so rural areas have to pay as much attention to this virus as the urban areas.
Back in July, it was reported that you had a private phone call, or someone from the White House in your organization had a private phone call with Minneapolis-St. Paul, or Hennepin County and Ramsey County, the two big urban areas, back around the last week of July, telling them they had to be more aggressive because things were spiking. What did you tell them in that phone call, or what was said to them in that phone call, and did they heed that advice and the warning you gave them back in late July?
That was a really important dialogue because every one of our health commissioners have a really great understanding of what's happening in their state. And so I do call many health commissioners around the United States really to see, are they seeing the same thing I'm seeing? And what are they going to do about it? And I can say that the health commissioner here is very much aware of what's happening and very much saw the data as I was seeing the data and very much understood that this was, there were pockets of infection within the Twin Cities that needed to specifically be addressed. And they're working very hard, working through communities and working through community centers and really adjusting testing down to the neighborhood and really making sure that the messages are being heard in each of the communities in the same way. And I think that's really critically important. Sometimes as public health people, we think if we just keep saying the same thing over and over again, eventually people will hear it. What we've learned in 40 years of work around the globe is it really needs to be tailored community by community and oftentimes age by age on the platform and the media that they are used to receiving information from. Because what's important is not only that they hear it, but they then internalize it into their behaviors. And I think this team here has such a great data and scientific background that they are really adapting and adjusting the messages to the specific communities.
Dr. Birx, one fact-checking question first. You had mentioned counties with certain percentages. I assume you were talking about the positivity rate?
Yes, I'm sorry. Yes, positivity rate over 10%. We also follow cases, and obviously this week cases were up about 16% across the state.
And then my question was, there's been a growing sentiment on social media and other channels that only the chronically ill and people with underlying health conditions really need to worry about this. Do you agree with that sentiment, or are you worried that it's going to result in complacency?
Well, I think there's two sides to what everything is always partially correct. So sometimes when it's a misinterpretation, we haven't explained things completely correctly. And so I really always appreciate people asking for clarification. When we talk about those most susceptible, it's those most susceptible to very serious illness. What do I mean by that? Significant hospitalizations and significant mortality. And so we know that people with pre-existing conditions, no matter what age, have a more difficult outcome. We also know that older people with those pre-existing conditions have a more difficult outcome, and that's why Minnesota, as well as many states, have worked so hard to protect their elderly in nursing homes. And so right now, Minnesota, we watch this data carefully every single day. I know that the group here does too, is we see that they're under 20% of nursing homes with even one case, often in the staff. And so they really are working hard, but that's not enough. There's 81 million Americans with comorbidities. And so in order to protect the 81 million with comorbidities, you need to protect the 330 million from spreading the virus to those 81 million. And so the reason your question is so important is because what happens in the nursing homes and what happens in the prisons and what happens in the daycare and the schools is a reflection of the amount of virus that's spreading in the community, among community members. And that's why it's really important no matter what your age. There's two parts that are important. No matter what your age, you can spread it unknowingly to one of those 81 million who could have a much more significant course. But even among the asymptomatics, remember, we only have experience of this virus for the last 8 or 9 months. We don't know the long-term consequences. So although we say it's mild or moderate disease right now, or they may not get that sick, we are starting to see young people with serious long-term consequences, or at least medium-term consequences. And then I think to imply that we don't know that that's going to be a long-term consequences, it's just we don't have enough data yet or seen people long enough. So we can't say convincingly to every young person that has mild disease that there won't be medium or long-term consequences. And so in the end, the community protects the community by stopping the spread of this virus community by community. It doesn't spread by mosquitoes. It's not running around. It happens between us, human to human interactions, and we know how to prevent that spread.
Deborah Birx, I'm curious, do you think that Minnesota, when it gets cold here, you have to be inside, basically? Are we going to see the same kind of spikes that states like Texas, Florida, Arizona saw earlier in the summer when it gets really hot there and everybody has to be inside?
I think we've learned a lot about ventilation and how important ventilation is, but it's also why we're asking every Minnesotan to work really hard over the next 4 to 6 weeks to really bring these cases down. Because when you have lower level cases, it's much easier to contact trace and get into those neighborhoods and find those asymptomatic spread and really know that you're containing the virus completely. That can be incredibly helpful. I remember I've talked to your health commissioner several times, and she was so great when I called the first time and I said, you know, your uptick is different than across the South. And she said, oh, well, that's because in Minnesota, when it goes over 50, everybody goes outside and it's summer. So that is different. So every state, and that's why you need to know those nuances. You really have to talk to people. It's why this is our 23rd state in just 2 months. We really believe it's important both get word and information to governors and the leadership through the report, but also come. See what's happening on the ground and really understand the individual reality of each of these states and how they're confronting the epidemic.
Dr. Birx, you have parts of this state who still don't believe COVID is a thing. I've been out and about kind of talking to people the last few weeks here, and there are parts of the state where they just don't believe this is a thing. You talk about tailoring the message to those communities. How are you tailoring the message to these communities here where they don't see this as a threat?
Well, you know, that's difficult for me to understand because we see the numbers on the TV and in the news every single day of the number of Americans who have lost their lives to this virus. We don't lose that many Americans to a virus like the flu virus every year. So this is a serious threat. But it is true, it's a more serious threat to specific individuals. What I can tell you, though, when you're walking down the street, I can't tell if that person I'm passing has primary diabetes. I can't tell that they have recently undergone chemotherapy and are immunosuppressed. So out of respect for one another, the virus is real, but most importantly, we know how to stop transmission to each other. And I think that's what we've learned over the last 6 months. We've learned the physics behind why masks are important, and we've learned that the handmade 2-ply cloth masks worked really well, which was a question for a long time. We know that you have to cover your mouth and nose. We know that physical distancing is important, and that makes sense to everybody. The less close I am, the less likely I am to spread the virus. We've learned that crowded spaces, both indoors and outdoors, can spread the virus and had spread the virus, whether it's a wedding, whether it's a funeral, whether it's a birthday party, whether it's just a Sunday afternoon dinner where we brought together our family from across the city and we're sitting in the backyard. If you don't have a mask on and someone is within 6 feet, virus spreading can and will occur if someone is infected. And so not only is the virus real, the consequences of the virus is real, the hospitalizations that we still have every week is real, the number of Americans that we have lost to this virus are real, but what is also real is we have a way to prevent its spread. And I think this really needs to be a balanced message of we have power against this virus, but it requires all of us to exert our power together.
Dr. Birx, piggybacking on that, Dr. Birx, you mentioned the spacing and then wearing a mask and avoiding large crowds. Are Americans getting the right message when they might have turned on the TV last week at the White House and saw nothing of those three with the convention?
Well, I'm telling you this as a public health person based on data. I tell everyone the same message. I don't tailor my message to the audience. So everyone hears the same message that I'm giving you today. And to every Minnesotan, I'm saying this is the way not only to protect yourself, it's the way to protect your loved ones.
Dr. Birx, you're on your 23rd state here. What has been the most impressive way that you've seen Minnesota handle this pandemic, and what's been probably you think maybe is our weakness in handling this pandemic?
I think the way that you have tackled this in a data-driven way, I'm always impressed when I meet with the team here of what they know, how they know it, the details of what they know, the strengths of the data and the data. It doesn't help to have data if you're not using the data to make an impact. And I really see that here, and you can see that in the vulnerable Minnesotans that have been protected over time, really learning from that original outbreak in Minnesota, in Minneapolis, and learning from that and applying those learnings to right now. And that has really prevented a lot of nursing home residents from getting infected, and that's extraordinarily good. I'm very impatient, so I get impatient when I don't see the Twin Cities numbers go down. And so we did have a lot of discussion about that. I'm impatient when research universities haven't. I've been calling on every research university that has these RNA testing platforms to develop their own lab-developed tests, to figure out how to do widespread collection, to validate it on saliva, and now that's happening. So, I'm always impatient. I always want it to happen like in April or May, not in August, but it's happening now in August. And I think making sure that every institution in Minnesota is contributing to really having testing available for the fall, just in reserve in case it's needed. And we had those kind of discussions about what's happening now and what we need to do to ensure everybody gets their flu immunization. And just think, if we all wear masks through flu seasons, we may have a much lower flu season, but get your immunizations anyway for flu.
We keep talking about a vaccine, but there are so many people. You're already hearing rumblings of people who, the conspiracy theories and the anti-vaxxers. I mean, there's going to be a lot of people who choose not to get the vaccine, and yet that's what we're putting all of our weight on. Is when there's a vaccine, what can you say to those who are questioning the vaccine, and any updates you have about that?
First, to every Minnesotan, don't wait for the vaccine to do the right thing. Do the right thing today, because if we do the right thing today, we go into the fall with much fewer cases. So don't wait. Wear your mask. Really work on what you're doing in your household to protect your family members when you get together. That is really going to be critical. We found in Miami that was really a lot of the spreading that was happening at the household level. There's a lot of vaccine skeptics until you show something works. And so I am always hopeful that when the American people see, like I will see, the data will be available, and they can see that the vaccine is safe and effective, that they will want to have that vaccine. Right now, we gain freedom through wearing our masks and socially distancing. With a vaccine, it's a very different potential interaction for all of us. And so, yes, I'm hopeful for a vaccine, but I'm also very convinced right now that we can stop community spread by wearing masks, socially distancing, and avoiding crowds. People think of crowds and they think of, oh, that's when I go to a concert. Crowds are a backyard barbecue with 25 people without masks. And that's what, going into Labor Day, we have to be telling one another and helping each other with, and figuring out how to socialize, maybe with less people, but really where we can stay 6 feet distant.
Can you just talk
Thank
briefly
you.
about the saliva test? Because it's something that Minnesota's placed a big bet on. How much do you think that will change the...
So just quickly on the saliva, it's a collection. So it's not a different, quote, test. It's a different way to collect. Rather than collecting from your nose, you collect from your mouth. So it's a different collection utilized on testing platforms, these RNA testing platforms, in the same way. So what it does is it frees up, it makes it simpler to get people to come to testing, because it's simple, it's easy, and the results are just as sensitive and specific. So thank you.
Thank you.
Thank you for coming.